There are lots of common medical and psychological conditions in the world, whether it's the common cold, tooth gaps, or social anxiety. There are a lot of conditions that are well known to the general public. But with billions of people in the world, each possessing roughly 60 to 100 genetic mutations that were not present in either parent, eventually some weird stuff is going to happen. And that's just one out of several potential causes of extremely rare and sometimes bizarre conditions people experience. So from werewolves to evil doppelgangers to randomly jumbled organs, today we'll be looking at 50 of the strangest medical and psychological conditions. Water is everywhere, and it is fundamental to all life on Earth. Even your body is comprised of about 60% water. Given how important it is, would it even be possible for a person to be allergic to water? As it turns out, the answer is yes, although it is extremely rare. The condition is known as aquagenic urticaria, and it was first identified in the 1960s. Since then, there have only been about 100 reported cases of water allergies. The condition presents in the form of hives whenever the person comes into contact with water of any form. It can be triggered by their own sweat or tears. These rashes appear within 20 to 30 minutes of exposure and typically last around 30 to 60 minutes after the exposure has ended. There's another form of the allergy, aquagenic pruritius, in which contact with water doesn't result in hives but does cause the skin to itch. For those with hives, they may or may not experience itching. Fortunately, the symptoms are typically limited to the skin, so those with a water allergy can still consume water, although it may result in a rash or swelling on their lips or the skin inside their mouths. In one case, a girl with this allergy would actually go into anaphylaxis if she drank more than a thimbleful of water, but hers seems to be an isolated case. What causes a person to be born with a water allergy isn't known, and there are limited steps that can be taken to treat the condition. Antihistamines or other medications designed to combat allergies may provide some relief, and oils and creams can act as a barrier to prevent direct exposure to water while a person bathes. Unlike with other allergies, however, exposure therapy has proven ineffective at reducing the symptoms of water allergies. Speaking of strange allergies, there is the autoimmune disease pemphigoid gestationis, or PG. PG first appears during pregnancy, usually in the second or third trimester, and is generally referred to as a woman's allergic reaction to her baby. The placenta contains tissue from both the mother and the fetus, and the fetal tissue contains the protein BP180. It is believed that the presence of BP180 in the placenta is what triggers immune system response, causing it to attack the protein which also exists in skin molecules. The result is a rash of painful blisters starting at the belly button and spreading across the entire body except for the face. Strong topical steroids can help combat these symptoms. It is believed that this condition affects somewhere between 1 in 20,000 and 1 in 50,000 pregnancies. The reason for such a large disparity in those estimates is that PG is believed to be underdiagnosed, as it is often mistaken for other skin conditions. There's no cure for PG, but the disease usually goes into remission shortly after the pregnancy has ended. Symptoms will usually only last for 3 to 6 months after giving birth, though in rare cases, physical contact with the baby may trigger further blisters and rashes. Once a woman is presented with symptoms of PG once, further pregnancies are all but guaranteed to trigger another flare-up. With its long history and myriad of beautiful landmarks, including the Eiffel Tower, Arc de Triomphe, and Notre Dame Cathedral, many people have a romanticized view of Paris. In reality, recent surveys have awarded Paris with such notable distinctions as the rudest city in Europe and fourth most unfriendly city in the world. This reality is a far cry from what many tourists expect when they travel to the city of love, and this stark contrast between expectation and reality, combined with the overall culture shock of visiting a foreign country, can result in something called Paris syndrome. Paris syndrome is seen as an extreme form of culture shock, which is itself often viewed as a form of anxiety. Psychological symptoms include hallucinations, paranoia, and irritability, while physical symptoms typically include things like nausea and vomiting. Though it is rare in general, Paris syndrome is most often seen in Japanese tourists. A big part of this is attributed to the idealized view of the West in Japanese culture, combined with the disproportionately large culture shock compared to Japan. Although the condition is named specifically after Paris, the symptoms are not necessarily exclusive to there. A person experiencing enough anxiety over the culture shock of traveling to anywhere in the world could theoretically present these same symptoms, but again, a reaction so severe as to include hallucinations is extremely rare. Uner Tan syndrome, or UTS, is named after Turkish evolutionary biologist Uner Tan, who discovered the condition back in 2005. The syndrome was first identified in a family of 19 from rural Turkey, of whom 5 showed the condition's defining characteristic, quadrupedal movement. Though people with UTS are often able to stand upright, they are incapable of bipedal movement, instead walking on their hands and feet. UTS is generally accompanied by severe learning disabilities, which Tan believes to be a symptom of UTS. He also speculated that UTS might be a form of devolution, though other scientists have called that claim scientifically irresponsible and insulting to the people who have the condition. Researchers have identified genetic mutations in 5 different genes thus far that are associated with the condition, and the cases have been split into UTS type 1 and type 2, with a proposed type 3. While identifying specific genes responsible for the condition may be complex, identifying the root cause was not, as the condition appears to be caused by extensive inbreeding. This helps to explain why it is so frequently seen alongside other developmental issues. Face blindness, or Prosopagnosia, is a cognitive disorder of face perception in which a person's ability to recognize familiar faces is impaired. It is believed that congenital Prosopagnosia affects 2 to 2.5% of the population, though with varying levels of severity. Some people with face blindness will only struggle in identifying casual acquaintances, while others may be unable to recognize their spouse or even their own face. Though rarer than congenital Prosopagnosia, there is also acquired Prosopagnosia. The symptoms are the same, but it is acquired as a result of damage to the brain. In either case, diagnosing the condition is difficult, as all of the tests designed to diagnose it are imperfect. For example, one of the common tests is the famous faces test. While the test can be a useful diagnostic tool, there is an obvious issue with attempting to standardize the test, as there is no list of universally identifiable celebrities. Even when it is diagnosed, there is no accepted treatment, and people with face blindness learn to utilize other clues like clothing and hairstyles to identify people. However, in studying face blindness, researchers determined that the brain has 2 different pathways by which it recognizes people, one conscious, one unconscious. Even though there was a lack of conscious recognition in people with face blindness, their bodies often still showed the same autonomic responses, essentially warm, fuzzy feelings that you would expect from seeing a familiar person. For those suffering from Capgras syndrome, the delusion that family or friends have been replaced with imposters is seemingly unbreakable. It's not necessarily all friends and family, and it may be restricted to a single person. Some researchers believe this is essentially the reverse of face blindness, and that a person will consciously recognize someone, but their body won't have the unconscious autonomic response from seeing that person. This would mean that although they can identify the person as somebody they know, something about them feels off. Their body isn't giving them the warm, fuzzy feelings that they would expect upon seeing that person, and it is believed that this lack of unconscious recognition is what causes the sufferer to believe their friend or loved one has been replaced by an imposter. Unfortunately, the extreme level of paranoia resulting from the delusion can sometimes lead to acts of either violence or self-harm. Capgras is a neurological condition that scientists believe is primarily caused by brain damage or degeneration. This means that if someone were to undergo some sort of trauma resulting in lesions on their brain, or if they develop Alzheimer's or dementia, they may also wind up suffering from Capgras. It is even more likely to develop in cases where the patient is already suffering from schizophrenia. But because the condition is so rare, there really isn't any course of treatment that has shown to be effective at combating it. The best doctors can hope to do is treat the other underlying conditions that may be contributing factors, like schizophrenia or dementia, in the hopes that this delusion goes away as well. Cotard delusion, also known as walking corpse syndrome, because it is a condition in which the sufferer believes that either they are dead, putrefying, are missing their blood or internal organs, or that they simply don't exist. One study of Cotard patients found that about 45% did not believe that they existed, while the other 55% believed they were immortal. Immortal in this context meant that they felt their decaying body was cursed to walk the earth forever in eternal damnation, rather than being a grandiose delusion of superiority. Cotard delusion is believed believed to be similar in nature to Capgras, just applied to oneself instead of another person. The causes are unknown, but there are a number of contributing risk factors such as psychosis, schizophrenia, depression, brain tumors, and lesions on the parietal lobe of the brain. Some patients also experience Cotard delusion as a side effect of certain antiviral medications. Medications including antidepressants, antipsychotics, and mood stabilizers have shown to be effective for treating the condition, though research suggests electroconvulsive therapy is more effective than pharmacological treatments. Or, in the case where it was a side effect of antiviral drugs, ceasing that treatment unsurprisingly caused an end to the delusion. Alien hand syndrome, or AHS, is a rare condition caused by damage to the brain. The damage can be caused by trauma, strokes, or degenerative brain diseases, though decades ago it was commonly observed in patients who had their corpus callosum severed as a surprisingly effective means of treating epilepsy. The first case of AHS described was in a recovering stroke victim. The doctor observed the behavior of the alien hand in his office, though the woman had no idea her hand was doing anything. Of course, not all sufferers of AHS are oblivious to the actions of their hands. Some will watch their hands do things that they actively don't want it to do, and in the case of damage to the corpus callosum, the hand often acts in direct defiance of what the person is trying to do. Someone with AHS might try to button their shirt with their dominant hand while their weak hand unbuttons it, or they could open a drawer with one hand while the other hand closes it. And in severe cases, the misbehaving hand might try to murder its owner by wrapping itself around their neck. Of course, this sort of behavior is generally restricted to when there is damage in the corpus callosum. Damaging different areas of the brain can cause the alien hand to behave in different ways. When the damage occurs in the frontal lobe, AHS is more likely to affect the dominant hand, and it is characterized by groping of any object within reach. When the damage is located in the posterior of the brain, it usually affects the non-dominant hand. Patients with this type of brain damage are most likely to view the hand as being an alien entity because the posterior parietal cortex plays a large role in our sense of self. As such, damage to this area resulting in uncontrolled movements can make the sufferer feel as though the hand is no longer a part of their self. While there is no cure for AHS, it is often only temporary. Temporary, in this case, might mean several years, but that's still better than forever. Our brains are resilient machines, and when parts of the brain are damaged, it will often rewire itself to restore functionality. Exploding head syndrome, or EHS, is classified as parasomnia, a group of sleep disorders that involve weird stuff happening before, during, or after sleep. Most parasomnias are things you've heard of, like sleepwalking or night terrors, but EHS goes into the group of parasomnias simply labeled as other. EHS happens just as the sufferer is starting to fall asleep. A person will be drifting into a deep slumber and then bang! Some extremely loud noise that doesn't actually exist echoes through their skull. Most people describe what they hear as either a gunshot, explosion, or cymbals crashing. Some people experience other sensory input as well, such as a bright flash of light. Little is known about this condition because of its unpredictability. Most people who suffer from exploding head syndrome will only experience the symptoms once or twice in their lifetimes, making it virtually impossible to study. There have been limited studies performed on EHS, there is no medical treatment available, and the causes are completely unknown. Fortunately, it doesn't pose any actual danger other than losing out on a little sleep, and it is not chronically reoccurring. While there isn't any medical treatment available, case studies show that one treatment that has been effective in treating EHS is reassurance, simply letting a person know that whatever they've heard wasn't real and that it's fine and they can go back to sleep. Trimethylnuria, better known as fish odor syndrome, is exactly what it sounds like. It is a rare metabolic disorder that causes a person not to produce the normal amount of the enzyme flavin-containing monooxygenase 3. This enzyme is responsible for converting the compound trimethylamine into trimethylamine oxide during the digestive process. For those people whose bodies don't produce enough of this necessary enzyme to oxidize trimethylamine while it's in the liver, the compound instead builds up in the bloodstream and is eventually filtered into the bladder. From there, it will exit the body via urine, sweat, saliva, and even a person's breath. Though this buildup of trimethylamine in the body does not present any health risks, the compound is characterized by a strong fish odor. Fish odor syndrome is a hereditary condition passed down by parents through a recessive gene. As with most genetic disorders, there's no permanent cure for fish odor syndrome, but the symptoms can be managed by avoiding foods that contain trimethylamine. This, unsurprisingly, includes all forms of fish, shellfish, and even seaweed. Some research research showed that daily supplements containing activated charcoal and copper chlorophyllin could eliminate or reduce the presence of fish odor in the vast majority of patients. Maple syrup urine disease, or MSUD, is another rare hereditary metabolic disorder similar to fish odor syndrome. While both conditions are metabolic disorders with somewhat silly names, fish odor syndrome is physically harmless, though it can be socially alienating, while MSUD is a very serious disease. Metabolic disease causes a deficiency in the branched-chain alpha-ketoacid dehydrogenase complex of enzymes. These enzymes are meant to break down specific amino acids, but those suffering from MSUD are unable to do so. This results in a toxic buildup of amino acids in the urine. If left untreated, these toxins will result in damage to the central nervous system, respiratory failure, and eventually death. MSUD gets its name from the sweet syrup-like scent of the urine in earwax caused by the excess of amino acids. These symptoms present within days after birth, and treatment requires constant testing of amino acid levels, a strictly regulated diet to control the amount of the offending amino acids that are ingested, and the removal of toxins from the blood through the use of dialysis and exchange transfusions. Though there is nothing that is considered a cure for MSUD, liver transplants have been shown to be successful at completely normalizing the patient's metabolic function, with the highest success rates in patients who receive transplants at a young age. Jumping Frenchman of Maine was first identified in 1878. The disorder gets its name because it was discovered and predominantly appeared in an isolated population of French lumberjacks in northern Maine. It's classified as a startle disorder, and the main symptom is for the sufferer to immediately obey any suddenly given command. The most common examples of commands were to jump or yell, but those with Jumping Frenchman would even strike a loved one if suddenly commanded to do so. Another slightly less common symptom was to mimic sounds or movements made by somebody else. The cause of Jumping Frenchman is unknown, though many believe it is a genetic condition since most of the cases are in an isolated region and there are often multiple cases of the disorder within the same family. Though once thought to be a neurological disorder like Tourette syndrome, more recent studies suggest that it may be a psychological condition brought on by the predominant personality traits and cultural norms in the remote area where it was first found. Synesthesia is a condition in which stimulation of one sense or cognitive path gives rise to an involuntary response in another. This can come in all different forms and combinations. For example, a person may be able to taste words or to smell music, but the most common form of synesthesia relates to colors. Some people identify individual letters and numbers as being different colors, or they may see colors and shapes when hearing different musical instruments or notes. Though the colors everyone experiences are different, studying a large sample size showed that certain colors are more likely to be associated with specific letters or numbers, though there was no such pattern found when it came to colors associated with sound. It is unknown how common synesthesia is, and estimates vary wildly. Some experts estimate the condition affects about 1 in 100,000 people, while others put the number as high as 1 in 4. There is no consensus on either the cause of synesthesia or the exact neurological mechanisms by which it occurs, though there is believed to be a genetic component. There's no treatment for synesthesia, primarily because nobody wants one. Most synesthesists consider it to be a pleasant or neutral experience and may even find practical uses for it. For example, those whose synesthesia is tied to letters and numbers can often use it to help them memorize names and phone numbers, as well as to help them with mental math. Those whose synesthesia is tied to music may have perfect pitch, because they can not only hear, but see, or possibly taste or smell what a specific note is. The list of ways synesthesists have taken advantage of this condition is at least as long as the list of different ways in which synesthesia can manifest. Aphantasia comes from the Greek words for without imagination, and that's exactly what it is, the complete inability to visually imagine things. It's a poorly understood condition, despite not being exceedingly rare. Aphantasia affects roughly 1 to 3% of the population, but most of them don't even know they have it. Those with aphantasia generally interpret other people's descriptions of mental imagery or of seeing things in their mind's eye as being metaphorical, without being explicitly told that what they are experiencing was an outlier rather than the the typical life experience, there really wasn't any way for these people to know that their brains were operating differently than anyone else's. But because of that, there's very little research on the topic. Aphantasia was first described in 1880 by British polymath Francis Galton, but after his initial observations, the condition was largely ignored until 2005 when serious research into the condition finally began. Though more is now known about how aphantasia presents, the mechanism behind it is still not understood. However, aphantasia only affects a person's ability to voluntarily visualize images, not to involuntarily visualize them. They are still able to dream and to hallucinate, just not to imagine what something might look like. Only recently discovered, gluten psychosis is an extremely rare condition that has only been observed in a handful of cases so far, though it has been seen in those suffering from both celiac disease and non-celiac gluten sensitivity. There was already a known correlation between gluten sensitivity and conditions such as autism, depression, and schizophrenia, but the significance of that correlation, if any, is thus far unknown. But for those with gluten psychosis, ingestion of gluten causes psychotic delusions that could cause the person to become a danger to themselves or others. In the most famous case, the patient tried to kill both herself and her family while under the influence of gluten. For those with celiac disease, it is believed that the immune cells which cause inflammation in the intestines may be escaping and making their way to the brain, where they cause the inflammation that results in the symptoms of psychosis. In non-celiac gluten sensitivity, it is speculated that the gluten protein may be leaking into the bloodstream and passing through the blood-brain barrier, where it then somehow triggers the symptoms. Because the condition is both so new and so rare, there is little research on the topic thus far. Fortunately, the symptoms can be managed by consuming a gluten-free diet. Although in many ways, alpha-gal syndrome, or AGS, is just like any other allergy, it is different in that it is the only allergy that can be introduced into humans by a vector. A person could begin suffering from AGS after receiving a bite from the Lone Star tick in North America or the castor bean tick in Europe. Neither bite is guaranteed to cause AGS, though it is more likely to occur from the Lone Star tick bites. When it does occur, it causes a person to become allergic to the carbohydrate known as alpha-gal. This carbohydrate is found in the tissue of all non-primate mammals, meaning that a tick bite could cause a person to become allergic to red meat. Like any allergy, the severity of the reaction to consuming red meat is varied and can be anything from mild nausea and diarrhea to anaphylaxis and death. While there is no way to treat AGS other than by avoiding red meat, some patients do find that the severity of their allergy diminishes over time, and in some cases it disappears entirely. The Fregoli delusion is a disorder in which the sufferer believes that many different people are actually a single person in disguise, or possibly they are all a single shapeshifter who keeps slightly altering their appearance. It is often classified as a paranoid delusion, as it is common for someone with Fregoli delusion to believe that they are the target of this person's persecution. Cases of this condition are rare, so it isn't fully understood, but the mechanism behind the delusion is believed to be a breakdown in a person's normal facial recognition. Essentially, whenever someone with Fregoli delusion sees a person whose face is somewhat similar to a person they know, their brain will identify it as being the same person. There are two main identified causes of Fregoli delusion. The first is brain damage, specifically to the right frontal lobe, left temporal lobe, or left parietal lobe. The other leading cause of this condition is medications used to treat Parkinson's disease, such as levodopa. Side effects of these medications include delusions and hallucinations, and in some cases, prolonged use can result in Fregoli delusion. While this is an extremely unlikely result for any given Parkinson's patient, Fregoli delusion is rare enough in general that these medications still qualify as one of the leading causes. While Fregoli delusion involves thinking that multiple people are really the same person, reduplicative paramnesia is the delusional belief that multiple places are the same place. Those with the condition believe that a location has been duplicated and is in more than one place at the same time, or that a location has been moved. For example, it has been seen among wounded soldiers who believed that the field hospital where they were being treated was actually back in their hometown. The first reported case goes back to the 1780s, though the patient also suffered from Cotard blood delusion. It wasn't until the 1970s that reduplicative paramnesia began being taken seriously as its own disorder rather than being symptomatic of other delusions. Although cases are extremely rare, making it difficult to study, the most likely cause seems to be traumatic brain injury, specifically when there is simultaneous injury to the right cerebral hemisphere and both frontal lobes. We've covered delusions in which a person thinks another person or place that they know has been duplicated, so now it's time to cover the syndrome of subjective doubles, in which the sufferer believes that they themselves have been duplicated. Essentially, the person believes that they have an evil doppelganger running around. At the very least, they believe that their double lives its own life and has different character traits than they do, though technically they could believe that they personally are the evil one. In some cases, the patient may believe that they have more than one doppelganger, and these delusions may be projected onto a specific person who they believe is their double. This may be projected onto a stranger, a family member, or anything in between. Because this syndrome is so rare and is usually, though not exclusively, comorbid with other psychiatric conditions like schizophrenia, it has been difficult to study the condition due to potential overlap of symptoms with other conditions. There is even debate over whether the syndrome of subjective doubles should be diagnosed as its own condition, or if it is more likely a symptom of other disorders. Unfortunately, the difficulty in studying the condition means that there is no agreement on the causes of the disorder, nor is there a universally accepted treatment. The most common form of treatment is antipsychotics. Erotomania is a person's delusional belief that someone is secretly infatuated with them. The believed secret admirer is usually someone that is completely unattainable to them, such as a celebrity, and it is typically someone that they've never met. This disorder is predominantly seen in women, particularly dependent women who are shy and sexually inexperienced. However, while women make up the majority of cases, erotomania in men is still considered to be much more dangerous. For example, John Hinckley Jr. was reported to have erotomanic delusions about Jodie Foster, believing that he would get her attention by assassinating President Reagan. Stalking, frequent gifts, and other obsessive behavior is common among those suffering from erotomania, and the stalking behavior is more likely to become violent in men. There is no ideal treatment for erotomania, as it has to be dealt with on a case-by-case basis. Sometimes it presents as a primary mental disorder, while in other patients it is symptomatic of other disorders. In the latter case, treating the underlying disorders can help deal with the symptoms of erotomania as well. When it is a primary disorder, antipsychotics have proven to be the most effective treatment. Aphantophilia, now referred to as body integrity disorder or BID, is a disorder in which a person has an uncontrollable desire to amputate one or more limbs or to be deaf or blind. BID is predominantly found in males, and the feelings of discomfort with their body begin between the ages of 8 to 12. It is most common among people who knew someone with an amputated limb when they were a child. The desire for amputation is so strong that it can lead to dangerous forms of self-harm, with the patient attempting and possibly succeeding in damaging what they perceive as an unnecessary limb so severely that doctors have to amputate it. A less dangerous coping mechanism is for a patient to live life as if they were an amputee, using prosthetics, wheelchairs, and other tools that aren't necessary but make them feel better. For those that wish to be blind or deaf, rather than wanting to remove a limb, they may partially or completely block their vision or hearing. The cause of BID is unknown, though there appears to be a correlation between BID and diminished grey matter in the right side of the superior parietal lobe. The more grey matter was missing, the stronger the desire to amputate. Autophagia is the desire to consume part of one's own body. Most commonly, this manifests as nail biting or hair pulling, but in severe and extremely rare cases, a person may try to consume their own flesh. This is often limited to biting their own cheeks, lips, fingertips, and arms, with some going so far as to bite off their own fingers to eat them. Unfortunately, research into autophagia specifically is limited because of how difficult it can be to identify. As we said, the most common form of autophagia is nail biting. However, an estimated 20 to 30% of the population engages in nail biting at some point in their lives, either due to stress, anxiety, or boredom. As a result, autophagia is studied under the broader umbrella of self-injurious behaviors. To date, no primary cause of autophagia has been identified. There's a wide range of possible causes, especially in mild cases, but severe cases of autophagia tend to be linked to other mental health disorders, particularly impulse control disorders. Clinical lycanthropy is considered a subtype of delusion disorder, a type of psychotic disorder. In this case, the delusion is that a person is either a wolf, is turning into a wolf, or can transform between wolf and human, be it at will or involuntarily. That's how it's generally described anyway. But the animal the person believes they can turn into doesn't have to be a wolf. In fact, of the 60 reported cases, less than half of those with clinical lycanthropy believed they are turning into wolves or dogs. They might believe they are a snake, a hyena, a bird, and in one case even a bee. The important thing is that they honestly believe that they are or can become whatever the named animal is. Treatment for clinical lycanthropy involves a combination of psychotherapy and medication, mainly antipsychotics and antidepressants, and it is largely effective. The difficulty with this condition isn't in treating it, but rather in identifying the cases. Because it is based on a delusion, the patient either needs to be witnessed while in a delusional fit where they believe they are an animal, or they need to be able to describe their previous delusions accurately when in a lucid state, assuming they are able to remember those delusions at all. While those with clinical lycanthropy may believe they can turn into wolves, people with human werewolf syndrome or hypertrichosis take on a somewhat wolf-like appearance. Werewolf syndrome is characterized by increased hair growth covering the face and body. This can either cover the entire face and body or be localized to specific areas, such as only one section of the face. It's an extremely rare condition, with less than 100 documented cases from all over the world. However, the congenital form of this condition is known to be caused by a specific gene mutation that can be passed down to a person's offspring. There's also an acquired version of the disorder that can be caused by cancer or as a side effect of various drugs. Acquired werewolf syndrome can be dealt with by treating the underlying conditions that caused it, such as removing cancer or switching to a different medication that won't have that side effect. But for congenital werewolf syndrome, there is no cure. The condition can only be treated either through permanent or temporary hair removal. Though cases of Koro have existed worldwide, it is officially classified as a culture-bound disease, as epidemics have disproportionately affected Asians, particularly Chinese. It's often described as being a panic disorder, especially because of how it begins. Koro essentially begins to manifest as a panic attack, in which the sufferer is 100% convinced that their penis is shrinking. It's shrinking, it's retracting into their body, and unless they can stop it, then it's going to fully retract and kill them. In Western society, this condition is commonly referred to as genital retraction syndrome or simply shrinking penis. After the initial panic attack subsides, the fear that the penis is shrinking does not. Sufferers may try to pull and stretch their penis, clamp it into place, or build elaborate contraptions to prevent their penis from fully retracting into their bodies, often causing themselves serious injury or even death. What's most interesting about this condition is the wide variety of causes. Though it has historically affected Asians more, in this case, culturally bound refers to the prevalence of various superstitions in different cultures. Outbreaks of shrinking penis spread across Africa when there were fears that penises would be stolen by practitioners of the occult, and they spread across medieval Europe due to fears that witches were going to make penises retract. Men have also begun suffering from Koro due to fears of sexual inadequacy, guilt over masturbation or promiscuity, or shame felt due to impotence. How likely it is for any specific aspect to be related to a case of Koro is dependent on the cultural and societal norms of the area. Fortunately, there are plenty of treatments available for those suffering from Koro, which are also culturally dependent. For those in the US, the main course of treatment is psychotherapy. Sometimes antidepressants and antipsychotics will also be administered, although this is usually only if there is another underlying psychological condition believed to be the root cause. But if the patient lives in China, common treatments include magical herbs, potions, and exorcising demons. All of these treatments have shown to be equally effective, which makes a surprising amount of sense. Since Koro is a delusion based on cultural superstitions, it only makes sense that cultural superstitions like magical herbs could also break the delusion. Dysautonomia is a condition in which the autonomic nervous system doesn't work properly. This encompasses basically everything that your body is supposed to do without you needing to think about it, such as regulating temperature, blood pressure, digestion, and even breathing. As such, there is a wide range of symptoms including sweating too much or not enough, low or high blood pressure, incontinence or constipation, brain fog, shallow breathing, especially while exercising, dizziness, tunnel vision, the list goes on. Essentially, anything and everything that your body is supposed to be regulating without conscious thought has the potential to stop working properly. Primary dysautonomia is often hereditary, but secondary dysautonomia can be caused by a wide range of different diseases, injuries to the brain or spinal cord, alcoholism, and more. Because the symptoms are so varied and can include your brain failing to regulate literally anything that it is supposed to be able to do without conscious thought, treatment is varied on a case-by-case basis and is designed to address that specific person's symptoms. Originally known as persistent sexual arousal syndrome, PGAD is a rare condition that predominantly affects women, though there have been cases reported in men as well. It's unknown exactly how rare the disorder is, since it's believed to be largely underreported due to overwhelming embarrassment, but there are estimates that as many as 1% of women may be affected by it. Historically, it has been confused with hypersexuality, as sufferers of PGAD may involuntarily orgasm 100 times per day. Of course, not everybody that suffers from PGAD actually orgasms. In fact, most people suffering from PGAD aren't able to without physical stimulation, instead just feeling like they've been pushed to the brink. They are left unable to sleep, to concentrate, to hold down a job, and even unable to leave their house because of a non-stop sensation that they are on the verge of climax. It is not only physically painful, but it's mentally devastating as well. As for what causes this condition, we don't have a definitive answer, though it's believed that it has something to do with pressure on nerves at the base of the spine. In about 2/3 of cases, women were found to have Tarlov cysts, a type of cyst that forms on that area of the spine. When the cysts were removed, some of the patients were cured of their symptoms, while others' symptoms became more subdued. But for the other third of patients, there didn't seem to be anything putting pressure on the nerves, which means there must be at least one other cause of this disorder. Auto-brewery syndrome, or ABS, is a condition in which a person's body turns into a brewery, specifically their small intestines. Since ABS essentially makes you drunk, the symptoms are exactly what you would expect. In addition to what might be considered the fun effects of alcohol, there's also nausea, vomiting, confusion, slurred speech, and loss of balance. Unfortunately, there's one other symptom of ABS that creates a perpetual cycle of drunkenness, which is sugar cravings. Sugar triggers the brain's reward system in the same way that alcohol does, so it's not uncommon for people to crave sugar while drunk. This is problematic because ABS is caused by an overabundance in the small intestine of specific types of bacteria and fungi like yeast. These microorganisms break down sugar and carbohydrates, converting them into ethanol, which is then absorbed into the bloodstream, resulting in the person with ABS getting drunk. Because of this, the main forms of treatment for ABS are cutting carbs out of a person's diet along with antifungal medication and probiotics to get the right balance of gut bacteria. Though it seems that anybody can wind up suffering from ABS, in general it's extremely rare. However, there are some risk factors that increase a person's odds, such as short bowel syndrome, type 2 diabetes, previous abdominal surgeries, and cirrhosis of the liver. Pica is an eating disorder in which a person compulsively craves and eats things that aren't food and have no nutritional value. The cravings are different for each person, and how dangerous it is depends on a specific person's cravings. They can range from mostly harmless, like the compulsion to eat ice, though this can be very damaging to your tooth enamel, to extremely dangerous, like the compulsion to eat metal or paint. There are a couple of main proposed causes of pica. The first is anemia and low hemoglobin. Not only are these characteristics frequently found in those with pica, but they are more likely to present in children and pregnant women, who are also the most likely to suffer from pica. The other main hypothesis is that pica is either symptomatic of obsessive-compulsive disorder and schizophrenia, or that it may be a form of OCD itself. Treatment varies by person, as does the efficacy. For some people, treating an underlying iron deficiency may help resolve their pica. In others, especially those who are developmentally disabled, behavior-based treatments such as positive reinforcement have a high level of efficacy. Of course, not every instance of a person eating a non-food item is evidence of pica. The diagnostic criteria for pica state that whatever the person is eating needs to be abnormal for their stage of development, and sometimes kids just like to eat dirt. Congenital insensitivity to pain, or CIP, is an extremely rare genetic disorder in which a person is unable to feel pain from the moment they're born. Their other senses work normally, and they can even feel touch and temperature. The only thing they can't feel is pain. This is an extremely dangerous condition, especially because it manifests at birth. Pain is important for development and for our continued survival because it tells us what not to do to protect ourselves. Feelings of pain and discomfort are also usually the first symptom of illness. Because they are unable to feel pain, those born with CIP often die at a young age due to injuries or illnesses going unnoticed and untreated. Most common injuries experienced by people with CIP are burns. There are a few different genetic mutations that can cause CIP, but the most common cause is a single mutation in the SCN9A gene. By preventing this gene from functioning properly, it shuts off all pain in the human body. Researchers are trying to see if there is a way to utilize this mutation to create effective temporary pain relief. On the other side of the coin, researchers in 2015 were able to use naloxone to allow a woman with CIP to experience pain for the first time, which we can only assume she was absolutely thrilled to feel. Naloxone has been shown to be effective in mice as well, although more studies are needed before this can be deemed a potential treatment for CIP. It has been speculated that Joseph Merrick, better known as the Elephant Man, suffered from Proteus syndrome, though the exact condition he had is not known for sure. That said, this speculation probably gives you a good idea of exactly what Proteus syndrome is. The disorder causes abnormal overgrowths of skin, bone, tissue, and blood vessels. Those born with the disease are typically born without any visible deformities, and the condition progresses over time. The extent and location of the overgrowths vary, but they will usually affect the skull and at least one limb. This excess weight can cause muscle pain and arthritis, and overgrowths can cause deep vein thrombosis and pulmonary embolisms, resulting in premature death. Different mutations have been proposed as the cause of Proteus syndrome, but in 2011, it was determined to be caused by a mutation of the AKT1 gene. Although the condition is genetic, it is not hereditary, instead being caused by random mutations of that gene. The condition is extremely rare, with about 200 cases known to have ever existed. It is believed there are approximately 120 people alive with Proteus syndrome today. There is no accepted treatment for the condition yet, but one group of researchers out of Australia performed a trial using the drug rapamycin, a drug usually used to prevent organ transplant rejection and to treat a rare lung disease. Though they claim that the drug was an effective treatment for Proteus syndrome, others have called into question whether or not the test subject even had the condition in the first place. Have you ever thought that sometimes there's so much beauty in the world that you feel like you could taste it? Well, then you may suffer from Stendhal syndrome. This condition has been observed for centuries, but it was named after French author Stendhal, who described his experience with the syndrome while visiting Florence. Essentially, Stendhal syndrome is an inability to cope with the great beauty of works of art and architecture. It's considered a psychosomatic condition, with the physical symptoms of rapid heartbeat, dizziness, confusion, and fainting all being the result of the psychological effect that the art is having on the viewer. In extreme cases, they may even experience hallucinations. There is debate among psychologists about whether Stendhal syndrome is even a real thing, and it is currently not listed in the Diagnostic and Statistical Manual of Mental Disorders, or DSM. That said, reports of tourists displaying symptoms of this condition are endless, with one Italian psychiatrist personally witnessing over 100 such cases among tourists in Florence. Fortunately, these symptoms are easily avoidable, as nobody is forcing anyone to go travel the world or to look at art. Another condition that has been observed countless times but is not officially recognized in the DSM is Jerusalem syndrome. Unlike other somewhat location-specific conditions like Paris syndrome, Jerusalem syndrome has a religious component as well. The condition seems to affect Jews, Muslims, and Christians alike, and it results in psychosis and delusions. People experiencing Jerusalem syndrome may feel they have a deep, significant connection to biblical events or historical figures. Many believe they were divinely chosen for some important, significant event, and some even believe themselves to be the Messiah. As we said though, while this is a well-described and observed condition, it is not officially recognized. There is a lot of ongoing debate on whether Jerusalem syndrome is a real disorder or whether it is just a manifestation of a person's previously existing psychosis. That said, the most well-known version of this condition, albeit the rarest, involves people with no history of mental illness becoming psychotic upon their arrival in Jerusalem. This psychosis quickly disappeared immediately after leaving the city. Named after Lewis Carroll's famous story, Alice in Wonderland syndrome, or AIWS, is a neurological disorder primarily defined by the distortion of visual perception. For those with AIWS, objects may appear larger, smaller, closer, or farther than they really are. These distortions of perception can even extend to the patient's own body. Though these are the most iconic symptoms of AIWS, it can also include distortions of other senses as well, particularly hearing. One thing that makes AIWS different from many other conditions, which is also a useful tool in diagnosing it, is that the patient is able to fully recognize that their hallucinations and distorted perceptions are not real. Their experience will often be unsettling and stressful, but the clear acknowledgement that whatever they're experiencing is somehow off and not real helps rule out any form of psychosis. AIWS most commonly appears in children, and the frequency and intensity of the episodes tend to decrease over time before resolving themselves. The disorder itself is generally considered harmless, even if it may be creepy and annoying, but it can also be indicative or symptomatic of other health concerns. Though there is no clear main cause of AIWS, and the cause of most cases is unknown, a number of cases were found to have been caused by viral infections, including Zika, the flu, and most commonly Epstein-Barr. But while they have been identified as a cause of AIWS, why those viruses trigger the condition remains unknown. Fibrodysplasia ossificans progressiva, better known as Stone Man syndrome, is a rare disease of the connective tissue. The disease causes muscles, tendons, and ligaments to turn into bone, making it the only known medical condition in which one organ turns into another. The condition is hereditary, though it can also result from random mutations. The ossification process usually begins by the age of 10, working from the top of the body to the bottom. Because it is extremely rare, occurring in only 1 out of every 2 million people, cases of Stone Man syndrome are often misdiagnosed as other conditions such as cancer. Unfortunately, these misdiagnoses can result in the condition being exacerbated. Any trauma can trigger or accelerate bone growth, including trauma from the biopsies used in an attempt to confirm other possible conditions. This also means that surgery to remove the extra bone growth is not an option, as it can result in rapid bone growth at the location of the surgery. There is currently no treatment or cure for Stone Man syndrome. According to data from papers published since 2010, the average life expectancy for someone with the disease is somewhere between 40 and 56 years old. You're almost certainly well aware of this already, but your tongue is covered in lots of little bumps. These bumps are called lingual papillae. Some of these contain taste buds, while others are used to detect texture and temperature. Geographic tongue is a condition in which parts of the tongue experience atrophy and lose their papillae. This results in the affected areas having a smooth, dark red appearance. There is typically a clearly visible and slightly raised line of demarcation between the affected and unaffected areas as well. The overall result is that the tongue winds up looking like a topographical map of an archipelago, hence the name geographic tongue. It's a very common condition, affecting roughly 2 to 3% of the population, though some estimates are higher. Fortunately, in most cases, it does not require treatment. Some people with geographic tongue experience pain or burning sensations, specifically when eating spicy or acidic foods, but for the majority of patients, the only symptom will be the appearance of the tongue. Typically, the tongue will go back to normal eventually, but it is impossible to predict how long this will take in any given patient. It will also frequently recur after a period of remission. The causes of this condition are unknown, though it does appear to run in families. Research has shown links between geographic tongue and other conditions like diabetes, psoriasis, and dermatitis, but in each case, other research has contradicted those findings, so we really don't know. Clinical vampirism was initially described as an erotic obsession with blood. In the 1980s, clinical psychologist and author Richard Knoll created the term Renfield syndrome, named after the character from Bram Stoker's Dracula. In Knoll's version, Renfield syndrome was an obsession with drinking blood and consuming live animals. At the time, Knoll meant this as a joke. He created Renfield syndrome as a parody of what he viewed as 1980s psychobabble, but the term was quickly picked up by popular culture and became synonymous with clinical vampirism, essentially rewriting the definition of the disorder. To be fair, neither condition has ever been a recognized disorder in the DSM. Though there are case studies involving patients who are obsessed with drinking blood, it is argued that their obsession was symptomatic of other psychiatric conditions and not a new condition in and of itself. Vampires and clinical vampirism may not be real, but one of the most iconic traits of the vampire is ectoderma pigmentosum. This is a rare genetic disorder in which the skin is extremely sensitive to sunlight and has a decreased ability to repair itself. Because the genetic mutations that cause XP can be passed down to a person's children, there is a huge disparity in the occurrence of cases throughout the world. Only 1 in 100,000 people worldwide suffer from XP, but in India, it affects roughly 1 in 370 people. Those Those who have XP suffer severe sunburns from even small amounts of sunlight, usually occurring the first time a child is exposed to the sun. Over time, this results in growths and skin cancer, and even minimal sun exposure is enough to cause freckling or burns resulting in blistered skin. There's no cure for XP, and the only treatment is preventative. Current medical science has not figured out a way to combat the symptoms, so the only treatment is to either stay indoors at all times or to be fully covered in protective clothing when going out during the day. Hematidrosis is a rare condition that results in a person sweating blood. It is not a congenital or chronic condition, and this could seemingly happen to anyone under the right circumstances. Hematidrosis occurs when blood vessels leading to the sweat glands rupture, causing the glands to exude blood from the skin. The blood may appear diluted with sweat depending on the person. This condition is not believed to be dangerous, as only a small amount of blood is lost as a result. While it can happen to anyone, it is believed to be triggered by extreme physical or especially emotional distress. For example, some of the most well-known cases of hematidrosis occurred in convicts awaiting execution, or a soldier who Leonardo da Vinci described as sweating blood before going into battle. Cyclic vomiting syndrome, or CVS, is exactly as unpleasant as it sounds. It is a chronic condition in which a person goes through a continuous cycle of excessive vomiting followed by a symptom-free phase. When in the midst of an episode of CVS, a person may vomit 6 to 12 times per hour, with each episode lasting from hours to months. The average length of one of these episodes is 41 hours. The episodes typically take place on a regular cycle. Though it varies by person, each individual suffering from CVS will start an episode at roughly the same time of day and lasting for the same amount of time, followed by a symptom-free phase that is also consistent. Though the cause of CVS is unknown and does not appear to be genetic, the condition itself seems to be closely related to migraines, and a family history of migraines or related conditions may put someone at an increased risk. Because CVS appears to be related to migraines in a yet undetermined way, migraine medications have shown some success in reducing the severity, frequency, and duration of CVS episodes. If an episode is already underway, strong antiemetic drugs may reduce the severity of an attack or cause it to cease entirely. Aside from pain, discomfort, and damage to the esophagus caused by frequent vomiting, the largest risk posed by CVS is dehydration. To that end, a patient in the middle of an episode that cannot be stopped with antiemetics will be given intravenous fluids to prevent dehydration. Situs inversus is a strange genetic condition, often hereditary. It occurs in about 1 in 10,000 people, making it far more common than many of the conditions we've talked about today, but it is still atypical. The name situs inversus is short for the Latin situs inversus viscerum, or inverted positioning of the viscera, referring to your internal organs. Those born with this condition have internal anatomy that is a mirror image of what would be expected. So a person's heart would be on their right side, their pancreas would be on the left side, and so on. It is easy to diagnose situs inversus with an X-ray or other form of imaging, but until it is diagnosed, the condition can cause doctors some confusion while running various tests where a response would only be expected on one side of the body. There is no realistic treatment for situs inversus, as any treatment would involve invasive surgery in which a person's entire insides were rearranged. Fortunately, there's no need for treatment, as the condition, though occasionally a source of confusion, is completely harmless. The most serious consequence of situs inversus is a difficulty in finding matches for organ transplants. Our organs are asymmetrical, so an organ from a person with typical physiology wouldn't properly fit into someone with situs inversus. If situs inversus meant that the location of the internal organs was inverted, you could probably then guess that situs ambiguous means that the locations of the organs are ambiguous. More specifically, they are seemingly random. This condition also affects about 1 in every 10,000 people, but it is much more dangerous than situs inversus. In more than half of all cases, the random placement of the organs results in severely flawed cardiac development, such as duplicated chambers of the heart. Treatment for the condition depends on how severely the organs have been rearranged and exactly where they wound up. While some cases are able to be managed, the severe complications of a person's organs being misarranged and malformed means that many cases result in death within hours of birth. Before anybody gets too concerned that their teeth could randomly start exploding, it's worth noting that there are only a handful of documented cases of this condition. Most of these are from the 1800s, and it's been over 100 years since the last report of an exploding tooth. The first recorded case took place at the end of August 1817. A Pennsylvania reverend woke up in excruciating tooth pain, and nothing he did could alleviate the pain. It continued all through the night, with the sleepless reverend pacing around his room in pain. When the morning came, he heard what sounded like a pistol shot inside his mouth, and he found himself having to spit out tooth fragments. However, once the tooth had exploded, the pain was entirely gone. Though the description of the reverend's case is often the most dramatic, the details of each case of exploding teeth are similar. A person felt unbearable pain, which was suddenly alleviated once the offending tooth abruptly burst open or exploded. It's worth noting that these weren't just urban legends. The stories were detailed in papers written by dentists in Dental Cosmos, the United States' first and at the time premier scientific journal of medicine. It has since merged with the Journal of the American Dental Association. It's unknown what caused these explosions, but the leading theory is that it was related to fillings. An improperly filled tooth might leave a gap in which gases could accumulate beneath the filling, and the fillings of the era included mixtures of metals that could potentially react violently with each other. That said, while it is generally accepted that the stories of exploding teeth were real, the severity of the explosions were likely exaggerated. Pseudologia fantastica, also known as pathological lying, is a chronic condition in which the person has a habitual or compulsive tendency to lie. Oftentimes, the lies are crafted in such a way as to make the person seem more important than they are, such as lying about wealth, power, or associations with wealthy and famous people. In many cases, their lies are also designed to make themselves appear as either the hero or the victim of a story. While those justifications make rational sense, even if they ignore the consequences of being a chronic liar, what makes the condition so strange is that there isn't always such a clear justification for their lies. Many times, a pathological liar will make false statements for seemingly no reason, even when telling the truth would have made them look better than the lie did. Frequently, those engaged in pathological lying aren't even aware of their own reasons for doing so. That's the claim anyway, but since such information could only be self-reported rather than determined by some sort of empirical test, there's obviously the chance that the patients were just lying. There is debate over whether pathological lying is a primary mental disorder or is only symptomatic of other conditions. It is currently only listed in the DSM as a symptom of conditions like antisocial, narcissistic, and histrionic personality disorders, though many believe it should be a standalone diagnosis. In most cases, the precise cause of pathological lying has yet to be determined, but in some cases, it has been shown to result from brain injuries causing damage, specifically lesions to the prefrontal cortex. You've probably heard of the cilantro gene, though most don't actually know exactly how this works. The OR6A2 gene is responsible for encoding a specific olfactory receptor protein in the human body. These proteins are sensitive to compounds known as aldehydes, which are found in both soap and cilantro. There is a common variation of the OR6A2 gene that causes the proteins to be more sensitive to aldehydes, and it is this increased sensitivity that results in a segment of the population describing cilantro as tasting like soap, vomit, or just generally being unpleasant. They may also equate the smell of cilantro to a foul odor emitted by stink bugs, as stink bugs also release aldehydes. The cilantro gene is hereditary, with a large variation in its prevalence throughout people with different ancestries. As many as 20% of people of European descent may have the cilantro gene, while in other populations that number can be as low as 3%. Visual snow syndrome, or VSS, is a relatively newly discovered neurological condition. It was first described in 1944, but it wasn't recognized as its own identity separate from migraine errors until 1995. Even then, more detailed research into the topic only began being published in the last decade. VSS is believed to affect 2 to 3% of the population and is primarily characterized by the persistent appearance of flickering dots across the visual field like an old staticky television. Other symptoms may include visual floaters, trails, starbursts, and afterimages. It is often comorbid with migraines and tinnitus, hence the delay in its classification as its own syndrome. Though the underlying mechanism of VSS is believed to be excessive excitability of neurons in the parts of the brain responsible for vision and proprioception, the cause of this excitability is unclear. In cases where VSS presented with a comorbidity, symptoms treating the other conditions sometimes help to reduce the symptoms of VSS. Fortunately, there is no effective treatment when VSS manifests by itself. Though various medications have been tried, all had low efficacy rates while also carrying the risk of making the symptoms even worse. If you've ever felt there was an insect crawling on you where nothing was there, you were experiencing a type of tactile hallucination known as formication. But for those with delusion or parasitosis, or DP, also known as Ekborn syndrome, this feeling never goes away. DP occurs twice as often in women as in men, and the average age at which the condition presents is 57. The exact details of the delusion may vary, but patients feel as though they have been infected with some sort of parasite, be it insects, worms, bacteria, or fungus. Patients may feel as though these parasites are crawling all over their skin, but they can also believe that parasites are beneath their skin as well. While DP can present as a symptom of other psychological and physical conditions, it is often a primary diagnosis. In primary DP, the patient has to have been experiencing the sensation of being infected for at least a month while presenting no other symptoms of psychosis. There's no exact cause of DP currently known, but it is believed to be related to excess dopamine resulting from a lack of dopamine reuptake in the brain. Formication is such a common symptom of drugs like cocaine that cause this same lack of dopamine reuptake that the delusions are colloquially referred to as coke bugs. Research suggests that DP is best treated with low doses of antipsychotics, but even with proper treatment, the delusions last for 3 years on average. Conversion disorder is when a person suddenly displays physical symptoms of neurological conditions without any identifiable organic cause. Common examples include a person experiencing blindness, paralysis, or numbness without any clear medical explanation, such as an infection or brain damage. The symptoms experienced almost always relate to either a loss of sensory or motor function in a way that causes the patient great distress. The cause of conversion disorder is unknown, but it is more likely to occur in people with a history of childhood abuse and who have other mental health conditions, particularly anxiety and depression. There's also some sort of triggering event, something extremely stressful or traumatic to the patient. Treatment varies from patient to patient, but it commonly includes psychotherapy, stress management, and hypnosis. For some patients, the symptoms may resolve in a few weeks, while for others it may take years, but either way, they could relapse at any point and begin experiencing their conversion disorder symptoms again. Fans of the show The Big Bang Theory may be familiar with the concept of selective mutism, as it was used as a plot device for several seasons. Those suffering from selective mutism are unable to speak in specific situations, places, or to specific people. The condition usually begins to manifest in early childhood by around the age of 5, and it usually presents alongside social anxiety disorder. While various studies show the concurrence of selective mutism and social anxiety to be anywhere from 80 to 100% of patients, it is a separate diagnosis rather than being considered symptomatic of social anxiety disorder. Selective mutism is relatively rare, though it's also believed to be underreported. It's estimated to occur in 1 in 1,000 people based on the number of diagnoses, but some studies estimate that it may be much closer to 1 in 150. The underreporting is from a combination of the condition being poorly understood by the general public and the fact that parents might not even know that their child has any symptoms, since they will function normally when at home. If a child is experiencing selective mutism in the presence of a doctor during normal checkups, this may be mistaken as ordinary shyness or stage fright. Though some children may overcome the condition as they grow up, it can often continue into adulthood without proper treatment. Medication may sometimes be used, but the primary treatment is various forms of cognitive behavioral therapy. As effective as the therapy is at helping people overcome selective mutism, there is a lot that is still unknown about the condition, simply because those who suffer from it are unable to tell their doctors what they're experiencing. Though once believed to be rare, fact-boyous fixation has become increasingly common over the past decade. The condition is characterized by an overwhelming compulsion to consume every last minute of high-quality, entertaining, and educational content produced by the patient's favorite internet fact-boy and his team. This is definitely a real clinical diagnosis and not something that the writer of this episode made up to see if you're still paying attention after over an hour. And thank you for watching.